Today, our program is hearing loss with aging, and our speaker is Mike Hefferly, and he is the audiologist and clinic manager at Rush University Medical Center, and he's going to discuss various topics and concerns we have with hearing loss and options and etc. So welcome, Mike Hefferly.
All right, can you hear me okay?
Yes.
Okay, good. Just want to make sure. I've been pressing buttons back and forth since I sat down, so let's make sure I'm live. Thank you, Terrell. Thank you all for inviting me to talk. It's a topic that I have no problem finding words for. I enjoy talking about hearing loss and things we can do to try to recognize ways to improve our everyday function. And that's really what this is about. I'm going to talk a little bit more about my thoughts on this. I will say a couple, preface this a little bit. In preparing for this presentation, I know, Terrell, you sent me a pretty ambitious list of things to cover. I'm going to do my best to cover a lot of the topics that I'm sure we want to discuss. I also look at how I develop conversations with my patients and their families, and that's kind of how I'm going about my presentation today. I think I tend to use a lot of analogies. Hearing and vision are not perfectly aligned when it comes to how they work physiologically, but there's a good analogy that can be drawn by when we think of how we see and how we comprehend, and I think we'll try to bring some of those analogies to bear here today, hopefully to kind of get my point over. But I guess the idea being is that these are the kind of conversations I do have with my own patients and their significant others. So we'll move forward. So today's program, so points of conversation, will certainly to review some of the challenges to how easy it is that we're able to hear and listen. I'm going to refer to that term ease quite a bit as we move forward, and I think it'll grow up pretty evident as to why. I'm going to talk a little bit also about what I kind of outlined 7 facts about the role of amplification, in this case hearing aids, the consequences of hearing loss or listening difficulties not being addressed appropriately. I think a lot of people already know kind of what this is, but I think it's worth just touching base on as well. The supporting roles. What kinds of roles would you expect from other people in your life to make things easier for you? And you are the leading role when it comes to this team, talk about as well. So Terrell also asked me to talk about some of the financial considerations and opportunities, and a little bit on over-the-counter hearing aids, which a year ago we wouldn't be talking a whole lot about, but now we can. And then, of course, questions. I want to make sure I have enough time to answer your specific questions if you have them. All right, we'll get started. Oh, this is going to pop up once in a while. This is my little I'm shooting up a flare every so often that there are certain slides that might be more important than others. And so you'll see that kind of peppered throughout the presentation as well. So this is last and only, I should say, numbers I'm going to post today. This is quite self-evident, but it's the reason we're meeting today, is that we do know that hearing loss, age-related hearing loss is actually quite prominent as we get older. A very large part of the population to some degree has hearing loss, and it just comes with a lot of other physiological functions that we we expect for some decline, just wear and tear over the years that takes place. So before we get started, I want to make the distinction, as I often do with my patients, that there is a difference between hearing and listening. And this isn't just applies to those who are older, it applies to all of us. So I want to start by making that distinction. So hearing is the way your hearing system will just capture sound and deliver it to your brain. That's all it does. It happens whether we like it or not. We don't have to make the point to try to hear. Our hearing system just picks up that sound. It's what we consider a bottom-up process, the delivery system. It brings information to our brain. Listening, on the other hand, I should go back here and talk about this hearing. This puzzle piece is meant to illustrate that hearing is just one piece of the puzzle when it comes to how we function. And as we introduce and talk about listening, just from a visual point of view, you can see hearing is one piece of several different factors that need to be working well for us to listen, not hear what people say, but be able to listen to what they say. So listening is what our brains do with the sound we deliver. We hear with our brains, we listen with our brains, but we hear with our ears. This is a top-down process. And some of the important things that I always discuss is that listening is a choice. You have to decide to listen. You have to have intention to do so, and you have to be ready to do it. Oftentimes we are in situations where someone may misinterpret that we didn't hear them, when oftentimes that it may not be the case. It may be that we just weren't ready to listen to them. Our minds were elsewhere. We were thinking about other things. So listening is really where I want to put the emphasis of our talk. You're not, again, trying to hear what people say. You're trying to listen to them. You're trying to engage in that conversation. And we need to recognize that how easy that is influenced by not just how well you hear what's being said, by a lot, but also by other factors that drive the ease at which we're able to do those types of activities. And so for us to be able to easily listen to what's being said, we need clear access to not just auditory cues, so the sounds in people's voices, but the visual cues. We gain so much information about what the person is talking about from lip movements, body gestures, that we use that so much to be able to, again, listen, not hear, but listen to what people say. Contextual cues are also very important. Think about times where you are listening to a lecture or a sermon or a conversation about a topic that you really have very little knowledge about. Your efforts to listen are much greater than if it's something that's quite familiar to you. So context has a lot to do with the ease at which we're able to listen, but it doesn't stop there. Getting back to the point is that we do listen with our brains. And so our cognitive function also has to be working very well for us to, again, to make listening an easy task. So our working memory comes into effect that if someone just say a simple sentence, someone says a long sentence, your ability to hold the first few words in storage until the rest of the sentence is finished, and then be able to go back and retrieve that so the entire sentence makes sense to you. So our working memory really supplies that ability to do that quite quickly. Our selective attention, being able to move away the distractions. They could be auditory distractions, visual distractions, things that are in your environment. Being able to selectively attend to what we want to attend to also is a function of our executive function. And to do it for a reasonable length of time. You might be able to selectively attend, but oftentimes your attention tends to wane. So how well you're able to maintain that attention is also very important for the task of listening. As you see on this slide, these things are susceptible to an overall decline in efficiency as we get older and with fatigue. And I'm really going to stress the word fatigue. Fatigue has a lot to do with how well we're able to execute these kinds of functions on a daily basis. So when it comes to listening efforts, if what we hear is incomplete or unclear, so if the bottom-up process is not delivering us complete, clear information, we have to work a lot harder to make sense of it. And when we talk about things like cognitive load, that's really what that refers to in an auditory system sense, is that it places much greater load on us cognitively if we are having to fill in, guess, and to work harder at trying to understand what's being said. So when you have a hearing loss, when you have a hearing impairment, it does take more effort to listen. I think those who are listening who have hearing loss will certainly attest to that. It just takes more effort. So to that point, hearing loss makes listening difficult. This much we know. And it is a vicious cycle. So the more difficult it is to listen, the more effort we have to give to doing so. The more effort we have to give, like anything else, the quicker we fatigue at any given task. And it creates a vicious circle. So when I sit down and talk to patients, I tell them that I'm not just wanting them to be able to hear better. I want to make sure that they're able to listen a lot easier than what they're currently able to do. So we do that by, again, making it easier to listen. Therefore, it's less effort to engage in those conversations and those listening tasks. And you're using less energy or less fatigue. we see oftentimes in children in the classroom who have just maybe a minimal hearing loss. They can get by, they can finish their assignments, they can get really good grades, but they are wiped out at the end of the day because compared to their peers with normal hearing, they're having to work a heck of a lot harder to do that. And it's no different no matter what age you are. Going through a day where you're having to put so much effort into listening will wear you out. And that fatigue has lots of consequences for your overall general health and your well-being. So everybody has had a hearing test sometime in their life. I'm not going to spend a lot of time on it, just enough to sort of move into what we want to talk about next. So when you have a hearing test, what is it that we learn from that? Well, the first thing we learn is just simply how well your hearing allows you to capture important speech sounds. Logic would follow that if you can't hear some of the sounds that are in people's voices, it's going to make listening a lot more difficult. So it's a measure of your sensitivity to those sounds. Then we use pure tones. This is the test where you sort of raise your hand or press a button every time you hear some tones. That's what we learn from that test. The second test that we do on a given hearing test is a way to see, okay, when you do hear the sounds, when all those sounds and words are made accessible to you, how clear and how distinct are those sounds? This is a measure not of sensitivity, but of specificity. So for those who've had a hearing test, in addition to the tone test, you are probably asked to repeat some words. And what we do is we give those words to you, but we make up for any hearing loss you may have. So we eliminate the hearing loss as a possible reason why those words may not be understandable. We put all the letters back in the words. At that point, we want to make sure that if we do so, all those individual sounds, all those individual letters are being made specific and distinct. And I'm going to give some visual analogies to kind of reinforce that. So hearing versus listening, what are the multiple challenges? And I kind of break them down into three areas. And I know there's a little bit of overgeneralization and there is some overlap, but we're going to talk about the physiologic limitations that come to some people more than others. The environment, which everyone is very familiar with, the environment is going to also drive how easy it is to listen, and the speaker and talker characteristics. So let's start with physiology. So we're going to start with the case of the missing letters. So a loss of hearing sensitivity. So this is a very common phrase that people know of. And this is an example if you were reading. So I will tell patients, for example, I give you a paragraph to read. And I take some sounds out of each one of those words, letters out of each one of those words. I would invite you now to take your time and read through this the best you can and try to figure out exactly what's being said. I'll give you just maybe about 10 seconds to do so. So this is the paragraph in which some of the letters are missing from the words, obviously. The analogy to hearing is when you lose hearing sensitivity, you're going to hear some of those letters, some of those sounds, but not all of them. And what I suspect happened just now is that your ability to read this paragraph took time, and it took a lot more effort compared to something like this, when I then fill the letters back into the words. So when those letters are missing, when those sounds are missing, you might be able to figure out the gist of what's being said, or in this case, what the paragraph is meaning. But it took more effort and it took a lot more time to do that. And when you have a hearing loss, having to do that constantly throughout the day, again, it can wear one down. So that's with full access. So the first fact is that hearing aids bring access back to speech sounds. They put the letters back in the words. That's all they do. They don't do anything other than that. So let's talk about the specificity or the clarity of what we do here. So I'm going to return back to this example of lack of access. This is what it's like to not have good hearing sensitivity for a lot of the sounds that are being said, or in this case, on the page. So when you have full access to sound, so let's say you have normal hearing, and you also have really good clarity. Or in the case of someone wearing a hearing aid, the hearing aid brings all those letters back to the words. this is what I would expect. It's an example I used before. So not only are the letters into the words again, but each and every one of those letters is separate and distinct. So it's very easy to be able to tell what word is what. But for some people, that isn't the case. For some people, we can put all the letters back in the words, but what they see, or in this case, what they hear, is very unclear. So this is exactly the same paragraph that I just showed you. All the letters have been put back in the words, but this one is a much more difficult paragraph to read. Not because any of the words, any of the sounds or letters are missing, it's because it's quite unclear. Some of the words are strung out together, so they're one or two words all together. The way that the font is used really makes it difficult to identify the letters in these words. So this would be a good example of someone who hears, but their hearing system isn't taking what they are hearing and keeping it distinct and clear. And this is an example of another paragraph, but this is one you haven't seen before. So if I were to ask you to see this one, you wouldn't be able to use any context. You would have to say, what is going on in this paragraph? So take, for example, as I said before, that if you're listening to a topic or someone shifts the conversation to a different topic and you're not quite sure what's being talked about, it makes it even more difficult to understand when what you are listening to doesn't have good clarity and definition. This is that same paragraph with normal clarity. So that's the difference. So fact two is this, is that the less clarity the hearing system provides for the patient, the less hearing aids can help. Again, hearing aids put the letters back in the words, but your ear and your hearing system is what's responsible for keeping everything clear and distinct. But here's the good news, is that although not everyone will have very distinct, the ability to distinguish one sound from the next or one letter from the next, most people have pretty good discrimination or pretty good clarity that they do benefit from hearing aids. Some better than others. Those who have really good clarity, you put hearing aids on, they do wonderfully well. Those who have a little lack of clarity, they don't do as well, but they do pretty well too. So the good news is that very few people have very poor discrimination or poor definition. And that's why most people with hearing loss do benefit from having hearing aids. So let's talk about the next factor. That's the environmental factor. And this is one that everyone is really mostly familiar with. So in addition to hearing loss, distance, how far the speaker is away, can also have problems. And this is the same whether you have hearing loss or not. Distance is going to be a challenge for someone with normal hearing as well. So here's someone who might be talking to you right in front of you. So you're able to see, in this case, or hear every word in their voice, very easy to understand what's being said. So let's say I push them further down the road, further back in another room, further on a lectern, or they're giving a sermon or at a meeting. All those sounds are available, but they're further away. So it takes a little more effort to read this paragraph or to listen to this paragraph because it's a little less visible or audible in the case of distance. So distance does limit the access to what we're trying to hear. Well, let's say you also have a hearing loss. So in addition to the person standing far away from you, you also have a hearing loss that's taking away some of those key sounds. So this paragraph becomes even more difficult to read. But if I'm able to, at least in those circumstances, bring those letters back to you, you're still going to do better. So yes, hearing aids can help when you're trying to listen to someone who may be at a distance. Background noise, this is the biggest challenge that we have. And I will tell you, it's a challenge for all people, hearing loss and normal hearing, but especially for those with hearing loss. And we'll talk about why that is. I have this guy who's stealing. I look at background noise as a variable that steals from us. It steals sounds away from us. So in this case, getting back to the quiet, nice, quiet environment, listening to somebody across the table, you're able to hear in every single sound that's in their voice. They're really close to you. Sounds beautiful. But when you get into noise, what noise does, it begins to cover up. It makes those sounds much more difficult to see, in this case, see, but in case of noise, hear. So background noise will steal the access of important speech sounds. So even with normal hearing in a crowded room, you may be able to hear all these sounds. You have the ability to hear these sounds, but the noise is taking them away from us. So this paragraph becomes much more difficult to read. All the sounds are there, but some of them are harder to get to because of the noise. Now, take a hearing loss into consideration. Now there's even less accessible to that individual. So in noisy places, people with a hearing impairment or hearing loss are going to struggle more than with normal hearing, because what you do have to rely on, you're limited even more because of the lack of access your ears or your hearing provides you. So the point being is that hearing aids can help in background noise. They do fill in some of those missing pieces and they do help you. Then the question I get was why? Why is it still so difficult, even with hearing aids, that I still struggle in noisy places? Well, let's talk a little bit more about background noise and its effects. This is where the age effect does come in. So even with full access to words and sounds in those words, background noise is more detrimental listening efforts for older individuals than it is for younger. So when we hold constant normal hearing, so if I have someone who's older who has completely normal hearing and someone who has younger and completely normal hearing, they perform on tests that are in noise much differently. Why is that? Well, one is because the extra weight that noise places on our hearing system. So I always think about how much noise interferes with what we're able to do. And I use an example sometimes that, let's say you had a bad back and I gave you something very light to carry. That bad back may still be there, but because of the lightness of that load, it's not a problem. You can take care of that. You can walk around the room, walk around the house. You can carry that load very easily. But the more I place on you, the more I ask you to carry, the more that bad back begins to reveal itself. And noise is weight on your hearing system as me piling a bunch of things for you to carry when you have a bad back. So that extra demand being placed on the auditory system and also on the cognitive system, the memory, the attention, all of that takes its toll over time. So on average, younger ears and brains do handle the extra weight better than older. So hearing aid benefits, it does benefit in noise, but it's also dependent on the individual physiological function. And that's why we talked about the physiology. Oftentimes, it's not a technology limitation, but a physiology limitation. So the last one is speaker and talker characteristics. And we all know people like this in our life. The quiet talker, people who speak very soft to begin with. The mumbler, where they run all their sounds together. The fast talker, I'm often accused of that, and I apologize if that's the case today. I'll try to slow down if it is. And the flat talker, someone who speaks very monotone. They don't use a lot of emotion in their voice. These are also types of delivery systems, you might say, that do make listening much more difficult. So another thing. Now, we need to figure out what we can do. So again, hearing aids cannot control for this, obviously. I can't make a fast talker slower with the hearing aid. I can't take a mumbler and keep them from mumbling. These are things that we have to look to try to control the best we can outside of that. But we know hearing aids certainly don't contribute to that. So let's do a quick review. So fact one is that hearing aids improve access to sound. In fact, that's all that they do. They put the letters back in the words. But hearing aids do not drive the clarity of what you do have access to. Your hearing system does that. And some hearing systems are still capable of keeping things very distinct and clear, while others are not. The fortunate thing is that most people that come through our clinic have pretty good clarity. That when we do put the sounds back in the words, they're able to understand them quite well. Hearing aids can help when someone's at a distance, and it can certainly help when we're in noise. But to that point, the older we are, the more harder we have to work in those noisy situations because of the extra weight the noise places on us. And again, can't control how the speaker speaks, at least for hearing aid can't do that. We might have something to do with that. And that's it. So here's a bonus fact. Most challenges that people face who have a hearing loss are simply due to the lack of access to speech sounds. And I tell patients, it's really difficult to understand something if you don't hear it to begin with. So that accessibility is very important. And that's why hearing aids tend to be a very good tool to help patients start moving in the right direction. Technologies that increase access do make listening easier. So the more access I have, the easier it is to listen, the less effort I put into it, and it kind of has a nice, not so much a vicious circle, but a nice circle. So let's talk a little bit about hearing aids. Now, the data is quite clear, and this is just an insert of all the evidence-based type of research that's been done. And we know that hearing aids certainly are associated with reduced rates of depression, loneliness, and social isolation and anxiety. And they are known to improve one's independence and their quality of life. The hearing piece of the puzzle, that's important here because, again, hearing aids only address the one piece of the puzzle that we talked about when it comes to listening, and that's the hearing piece. We need to recognize, and that point is that we need to recognize that there are other challenges important toward developing a more holistic approach to management. So if all we're doing is taking one piece of that puzzle and filling it in, but not addressing what other pieces also need to be in that puzzle, then we're not really looking at to help maximize our patients' ability to function well. So easy listening, that's really what I want. I want my patients to put so much less effort and time into listening. So we have to make sure that we provide as much clear access to auditory cues, visual cues, contextual cues. Visual cues, your eyesight has a lot to do with that. Your ability to sit in a dark room versus a lit room, bringing someone closer to you than someone far away. What can you do to control for your access to visual cues? Contextual cues are big. Contextual cues can be you're going to a meeting. You have an idea of what that agenda is going to be about. You have some context there. So context is really important. I ask patients who have a familiar set of friends and they go out to eat or they go to a club or play cards. It's a very easy thing to do, but not something that is intuitive. That if we're going to shift to another conversation topic, if we're going to move away from one thing to the next, let's let everybody know that's what we're going to do. Because it's once we have the context of conversation, that task of listening is so much easier. And then, of course, our executive function, our working memory, our attention, all those things are driven very much by our physical, mental, and cognitive health. So what steps that I know all of you do to ensure you maximize that certainly has huge consequences to how easy it is for you to function and to listen to others. So I ask my patients to sit down now and say, okay, what else can we control for? Hearing aids, we can bring some sound back. We have control of that. But how else do we do that? And I mentioned some things already. How do I keep the distance from being so far away? Where do I sit? How do I make sure that I'm there? Background noise. Are there times where I can say, okay, let's find a different place to talk, or can I turn that down, or can I move to a little different place in the room? Same thing goes for access to visual cues, access to contextual cues, and even the speaker characteristics. Now that's a tough one. It's hard for your grandchildren to understand that when they speak very quickly, when they change one topic to the next, for them to understand that is kind of puts us at a disadvantage. But for some people, they need some reminders that even speaking a little slowly, just making sure you have access to all those sounds goes a long way in how well you're able to listen. And the last thing you have some control over is at least optimizing your physical, cognitive, and mental health. So age-related hearing loss and how we function, what we know as of today. So the data is pretty rich and pretty robust, is that those who have hearing loss and all the consequences that occur because of that have a much greater rate of hospitalizations. Their isolation is much greater. They use the healthcare system a lot more, and they are also more at risk for falls. Social health, psychosocial health, stigma, isolation, all those things are consequences of disengagement from activities that would otherwise bring quality of life. So we know that not being treated appropriately, or at least the best that can be done, is going to end up in a lot of things that cascade. So I'm not going to spend a lot of time on this, but I think it's an important slide to kind of look at. So changes to brain and structure function, increased cognitive demand, social isolations are all things that we know are possible when we have hearing loss that goes untreated. This diagram is a little on the complicated side, but what you'll see is that simply there are different causes for different things, or at least in this case, strong correlations. So if you look just at physical health, vascular disease, genetics, those kinds of things can lead to a declining health in the auditory system, which then, as a consequence, we start losing access to sound, we start losing clarity of sound, which then cascades into all the other things that bringing that information to a brain allow us to do. So we look at it here. This is what we do to try to treat. We need to treat sooner. We need to intervene prior to these changes, that these sort of, again, cascading consequences of not being treated. I would like, if you would like, and you have the time to do that, my colleague, and I'll introduce her in a little bit at the end, is a researcher in hearing and aging. And she spends a great deal of her time looking at really some of the physiological functions that drive the health and function of our auditory system, and also how we function cognitively. She's a wonderful researcher, a terrific presenter, and I think she would probably do much greater justice than I could in the short amount of time we have if you're truly interested in that. But the research has become quite robust and is showing us very close correlations and beginning to show causal effects, that when hearing loss goes untreated, that we also start to see physical changes in our cognitive brain structures and function. So the listening challenges and hearing loss as a result of that, how and who can help us? So what I always like to remind patients of this is that there are two sort of treatment models in healthcare. One is an acute model and one is chronic. The chronic disease model is really what we talk about mostly for hearing loss. Hearing loss, especially as we get older, is a chronic disease. There's nothing that can be treated acutely, as if you have cases of a broken leg or getting the blood sugars up, those kinds of things. So when it comes to chronic disease management, the principal caregiver is you. It is the patient. It's the principal caregiver that has to have the tools to manage the everyday effects of disease. They're the ones providing the care. The healthcare professionals, the role that they play is advisors or educators. My job is to help assess what the needs are of that individual and to help build the skills that they need to have in order to manage those day-to-day effects. So the job of the health professional is to facilitate the treatment by teaching and providing better self-management skills. So how can we support your efforts? Well, you obviously are going to be the primary driver of this, but your primary care physician can certainly help in making sure that they're understanding what hearing loss means and how important it is to intervene as soon as possible. The audiologist, which I'll talk about more since that's what I do, but we can't ignore or dismiss the support of family and friends, and an example of what we're listening to today, the community support that people receive are so important factors who have proven to be critical to success. So your audiologist, what should you expect? In fact, what should you demand from your audiologist? Let's talk about the basics. If you go to an audiologist for advice or help, you should expect them to provide guidance and cooperation in making a fully informed decision. My job is to make sure that whatever decision you make, whatever it is, whether it's a technology or simply whether to get a hearing aid or not, or to move forward with other strategies, needs to be fully informed. So it is a cooperation. So it's not something that the audiologist is driving. It's being driven by you, but we're here to help sort of guide that decision. They should be good listeners to find out what you need. I always say if an audiologist doesn't take the time to find out what your specific needs are, they may not have your best interest in mind. They need to find out what your specific listening needs are. What are the activities that are important to you? To that point, the technology, there's so many different technologies from very basic to every bell and whistle known to man. I look at it as a big part of my job is once I know what your needs are, to better match the technology to those activities. There's no point in having a bunch of bells and whistles that you do not need, and in many cases end up paying for. So my job is to really find out what's the best match for your needs. Also, you should expect continuous support. This is not going to get a pair of eyeglasses and come see me if you have any problems. Hearing is a very different animal. It's a very different, much more complex sense, and you need continuous support throughout the process. And again, not just to improve hearing, we need to look at what other strategies can we put into place to help you be able to do well overall. And then an evidence-based approach to treatment and hearing aid programming. We'll talk a whole lot about that in interest of time. And follow-up services. Audiologists should be available. You're going to see more and more in the health field, hearing instrument specialists and audiology assistants to increase the accessibility when problems occur or when questions occur. And this whole idea about the physiological limitations, realistic expectations are huge. And I think all of you would agree with that. If you know what the limitations are, we can better address other things we can do to support around that. And those physiologic limitations I mentioned earlier have everything to do with that. There are just going to be some ears that no matter how much access to sound they're given, just aren't going to deliver the clear signal we want. It's important to know that going into hearing aid and to understand, okay, now what else should we do in support of that? Because we know we're going to be limited. And then also, I think the audiologist, or at least the assistants, should help you guide you toward financial resources when appropriate and when necessary. So technology itself, when you talk about different tiers of hearing aid technology, it's driven mostly by the function of background noise. What are the needs one has? So how we address that is we try to increase the speech to noise ratio. How do I get the speech you want to hear and listen to above the noise in which you don't? So there are many algorithms, including some new artificial intelligence that seems promising, not quite there yet, but getting there. We use different types of microphones, peripheral devices like remote microphones, TV streamers, and even smartphone streaming has become a really good way to address some of the phone issues that have been difficulties in the past. So I'm going to share a few of my opinions, and this is my opinions only, is that just because you can do it doesn't mean you should. There are so many technologies out there, and I don't think that a lot of manufacturers think, well, yeah, I can do it, but doesn't mean it's really necessary. So I think, again, getting back to what is it that's proven to be helpful and what is really that, what does that individual need? Again, technology should match the needs of the individual. I would ask that you trust your audiologist to choose the hearing aid manufacturer. Not one hearing aid manufacturer has a monopoly or has a corner of the market on the technology. It has more to do with their philosophy in developing it. And I think you're going to be better served by an audiologist who uses a manufacturer that they are very familiar with, all the ins and outs, know how to make changes if they need to, so they can better serve you. Some hearing aid styles can be limiting. Understanding the pros and cons of each are very important. So something very small and custom to something behind the ear comes with pros and cons. It's important that you know what those are before deciding what you want, which direction you want to go. So a couple things on financial support. Medicare Part B still doesn't cover a dime when it comes to hearing aids. But the Medicare Advantage and replacements, we're seeing more and more of some help. Some a lot of help, some a little help, but we're seeing more of these associated with discount programs. Medicaid usually do pay. Usually it's just one hearing aid, but they do cover the cost of at least one. Commercial insurance, again, usually. There's no single standard. They all have different benefit packages, but they're usually the better of the packages. And then for those who want to finance them, I know Rush and a lot of other places use Care Credit. You may be familiar with that as well. So those are other ways that can help finance the cost of hearing aids. So quickly about over-the-counter hearing aids. This is a new classification of hearing aids. It's not the same thing that you've been used to or may have been fit by your audiologist. These hearing aids does not require a medical clearance, so you don't need a physician to say that it's okay. You don't need me. You don't need an audiologist or a hearing instrument specialist to fit it. They need to have medical warnings on all their packaging, and they most have self-hearing screens when you put them on. This is really off-the-shelf type of a hearing aid. It's a good option. I'm in favor of it. I think it's going to help a lot of people, has helped a lot of people. The accessibility financially is much easier. Even though $1,000 is nothing to sneeze at, for $1,000 you can get a pair. This includes the product. There's no service charges that maybe a professional might offer. There's no additional medical healthcare expenses, so you're not having to go see a doctor, you're not having to get a hearing test. And some of the technologies that are available in hearing aids that we use are available in these as well. So there's some benefits that can be had. Here's why it's not always the best option. is the risk that someone's going to get a hearing aid when they should in fact be treated medically. That's the scary part. And that's what worries me a little bit. They're not appropriate for people with severe to profound hearing loss. They're only for mild to moderate. Data has shown that patients may not be the best judge of the degree of hearing loss and the configuration, which sounds they have a harder time hearing. And there's no way to truly verify whether the hearing aid really is providing the appropriate amplification. People who are not sort of user-friendly with technology can struggle with this. If they have trouble with dexterity, if they have unique canal shapes, those makes the fitting of these devices a little bit more difficult without the assistance. And some of the advanced noise reduction technologies for those who really have needs to be in loud, noisy places really aren't available through these. And the other thing that worries me is that if all this were true and someone tried this and they didn't have success that they really thought they wanted to, that this would discourage them, that they wouldn't then seek out maybe some assistance, just a little bit of help they might get from an audiologist to help them do better with this device or with a different device. So I worry about them not doing well and making the decision at that point that, you know what, I tried something, I'm never going to try anything again. That's the thing that gives me a little concern about it. So a couple parting shots. I would ask that you don't read too much in the success and failures experienced by others. Oftentimes people will choose not to pursue some intervention because their neighbor or their friend or their wife, their spouse did not do well with what they had. Remember the beginning of this talk about the physiologic limitations that often drive success. Those things are very difficult to know just by looking at somebody and talking to them about that. So it could also be the case with you, but most of the time it's not. So I want just be careful not to read too much into that. And I always say, consider not your hearing, but whether or not your hearing problems are requiring you to expend more effort than you can easily give. I can't say it in a better sentence. Everything I've been trying to say in this talk is that's what I ask patients to consider. Forget about the hearing. Tell me whether or not the problems as a result of your hearing loss are making you put so much effort into listening that it's causing you to be fatigued. It's making you disengage. It just takes too much work. I'm just not going to do it. And the frustration that you feel, you and others who are also communicating with you. And again, do not underestimate the relationship between your health and your hearing and your overall health. Data is piling on top of data saying that there is such an important factor in maintaining good hearing health correlated with good overall health. So I want to thank everyone, especially the Chicago Hyde Park Village community, for inviting me. My Dr. Uzma Ashtar is on faculty with me at Rush. She helped me with the 2 slides that you saw. She provided those for me, and I think she would make for a very interesting guest speaker if you wanted to learn more about aging and hearing system health and cognitive function. And of course, I want to thank you for your time and your generosity for having me today. That's my little guy. He goes in every one of my presentations. So I'm open to questions.
A couple of comments. One is today's program and speaker came to us from Hyde Park Village member Lori Rosenblum. She presented it to the program committee, and so we went forward with it. So if any of you have any other ideas or thoughts or speakers, help us out. Then also the hearing loss support group. One of the things that we often hear from Jenny Cook is that one of the conversations they have for those of us who may not have a hearing challenge, but a topic they discuss often is how to have a conversation with somebody who does have a hearing loss. And this program today will be recorded and then placed up on the Hyde Park Village website. So you'll hear more about that later. So tell friends who weren't here today and those people that you speak to that couldn't hear. We have one question so far. And this is from Kathy Williams. Do you want to ask your question, Kathy?
In trying to get back to going to movie theaters, my friend and I are finding that the volume is always overpowering. Also at concerts, and sometimes in nightclubs. And I was just wondering, are there any laws or are there any discussion of laws regarding decibels in these public spaces?
Yeah, there are guidelines that are given, and the OSHA and some other organizations do say you have to make sure that the public is safe. So there are public safety guidelines, but the bad news is that they're never really enforced. And the only way we ever get them enforced is when people say something about it. I think a lot of it is left to it's business, right? It's if you're going to stop coming to my business because these are the things that are making it difficult for me to come, then that's what really gets to them. So yeah, you can certainly you can report them to the Better Business Bureau, who will send links out and do monitoring. There is something called a dosyometer, which gives you the average amount of sound that over the course of the event or the day. Those kinds of values is what helps determine what needs to be done. But I think your point is that things are still too loud, and there doesn't seem to be anybody really regulating these things.
Oh, I have a question.
Go ahead, Joe.
You indicated that ideally the audiologist ought to suggest a hearing aid tailored to one's individual needs. But I noticed when I got some literature a while back from my Blue Cross policy that they apparently have some connection with one hearing aid company. So if you want to get a good deal price-wise, so to speak, from Blue Cross and Blue Shield, you would be limited to their prescribing if you go to whomever office they use to limit it to that one hearing aid. Doesn't that present some kind of a problem from getting fitted with one that might be ideally best, even though you have health insurance to cover part of those costs?
Yeah, I've seen more and more of that where they will cover a certain technology level, that if your needs maybe require a little bit more, then you're kind of hamstrung on what you can get through your benefit. You know, there's a lot of work to be done yet. We were pleased that the insurance companies began to offer some benefits, but we can't just accept that this is what it is. I will say though, when I look at the technology levels in which they're offering, they're not offering just sort of the bare bones. These technology levels are more in the standard to advanced models. So I would say for most people and most demands that they have, that technology is going to be appropriate. The highest end technology, every bell and whistle known to man, this is going to be my opinion blurb, is that hearing aid companies, manufacturers release new technology every 6 months. The FDA classification for hearing aids doesn't require them to provide any clinical evidence, independent research to say that what they have now is in fact better functionally than what already exists. I remain for that reason very skeptical about anything that comes out on the high end that's new until I see evidence that that type of technology really does translate into better function. Is it really cost effective? So even the highest level technology, the fact that it may not be available through some of these programs doesn't give me too much pause. I'm not so worried about that. I still believe there has to be some choices. And if you're given one choice, I agree with you, then you're pretty much being told, I don't care what your needs are, this is what we're going to fit you with. But again, just to reemphasize what I have seen in those technology levels, it's good technology. It's current generation technology. And for the most patients that I would see, that technology is really the one that I would use most often.
Okay, thank you.
I have a question. First preceded by a comment. A friend of mine said when the hearing aids were available over the counter, one of her comments was, be cautious because the person helping you could have been the clerk who was filling the shelves the day before. So if you do find yourself going to an over-the-counter organization or store, what kinds of questions would you need to ask to be sure you're getting some kind of accurate, good information?
Well, that's a good question, because now these devices are offered at so many different sites that you're not probably likely going to get a very informative or educational type of answer for what you want. I think a lot of people are still learning. I've not done myself a chance to just kind of go in as a secret buyer and do the same thing. I thought about doing that. I don't think it's intended for that, quite frankly. I think that these over-the-counter hearing aids, another analogy with vision, are kind of like reading glasses. You find one that works and you take it and you see how it goes. Some of the manufacturers do offer, once you take the device, there are consumer lines where you will likely get somebody. Sometimes you'll get an audiologist, depending on who you work with, if someone's a little more informed. So I don't know that you're going to get a lot of really good answers on spot, on site, but some of the consumer support hotlines or websites should certainly provide some of that information that you might be looking for.
Other questions or comments? Anna Grace.
Well, I think the connection you made between hearing and overall general health is very important. My husband wears hearing aids, and fortunately we're able to afford them. But I think getting over the counter, even with all the problems, at least maybe some folks who have not had decent hearing can have access. Now we need to tackle the dental, because of course most of our insurance doesn't cover in dental. Medicare doesn't. And dental health has a lot to do with overall. So I think hearing and dental, I'm just glad they're getting an attention, and I think we just need to continue to push.
Yeah. I mean, accessibility to healthcare has proven to be just one of the biggest variables to overall health.
Yes.
And I think, there was when over-the-counter hearing aids were being batted around as an idea, there was some audiologists felt that there was a threat to the profession. Us others thought it was only going to be good for us, because that gives patients much more access to those kinds of things. I've always been in favor. The things that always gave me concern that I was assured of is just the safety regulations, the packaging. Patients need to understand what those things are. We do offer Rush, and I think more and more people will start doing that, is if we find a patient who just says, yeah, over the counter is a great option, I am all for it. I'll make recommendations when I sit in front of the patient that this is probably a better option for you. But we also offer services. So if they want to get one and then come and see us, we can certainly show them some orientation. We can actually do some verification if they want to make sure it's the right thing for them. So those services are still available. And I want patients to know that. So if they do feel like they're struggling, it may just be temporary. It's something that maybe we can help teach them, and off they go. They're where they need to be.
Thank you.
I know when I,
Oh,
go ahead. Who's somebody raised?
I have another question. Does anybody know how often Medicare will approve of a hearing test done by an audiologist? The reason I ask is I had one done at the University of Chicago a year ago, and they recommended that I needed a hearing aid in both ears, which kind of shocked me because I didn't think I had any significant problem. So I puttered around and put off. And then I finally talked to an audiologist about after 6 months, and I was told that a hearing test for an audiologist to make use of a hearing test and prescribing a hearing aid, the test needs to be within 6 months of when you're seeing the audiologist. So mine is a year old, so presumably means I need to take another one. So question is, how often does Medicare approve of that? Is it once a year or less frequently? Does anybody know?
I can help with that. So up until recently, Medicare frowned on routine hearing tests. That if the person had no perception of a change in their hearing, or if they had tinnitus and they didn't perceive a change in that, or even if they had balance problems, vertigo, and perceived no change in that, then Medicare would not consider that test medically necessary. So they would not say that that is something they would cover. Recently, though, Medicare has passed a bill, a policy that has changed that to some degree. So now what we can do is that if you do notice a change in your hearing, you can have a hearing test whenever, as long as those changes are documented and you do self-report them. The other thing about Medicare that does complicate things is that for Medicare to cover the cost of a hearing test, it requires mostly a medical order. So it needs to come from a physician, a physician's assistant, or an RN. So it's a diagnostic test and it does require that order. So what we've had problems with in the past is that when we see a patient who's had a change, they say, you know what, my hearing's gotten worse, but they've had a hearing test in the past 6 months. We still have to get them to see a doctor and get an order. That no longer is the case. An order is not necessary so long as they themselves have felt there's been a change in their hearing. The 6-month issue has to do with Illinois regulations. Illinois does not allow a hearing aid to be fit if the hearing aid is over, if the hearing test is more than 6 months old. So that's just law. That's part of what needs to be done. But if you, in your case, that was the case and you needed another hearing test and you felt that your hearing has declined during the past year, then an order from your doctor wouldn't be necessary. We could just simply get you scheduled and tested. Did I muddy the waters, or is that any clearer?
Okay, thank you. I do notice I made one change. I noticed when I answered the phone with my right ear rather than my left, because I didn't realize my hearing was better in one ear than the other until I had this a hearing test. But for most purposes, like for example, I've heard every word that you said with no difficulty whatsoever. I only notice that at noisy, very noisy places in a noisy restaurant, I might have trouble hearing the person sitting across from me, and which apparently even hearing aids don't entirely compensate for in many cases. So I'm not sure what to do. Because there was also some indication that if you do need one, it's getting one earlier is better than getting one later.
Yeah, there's some evidence that supports that. I think, again, the question, if you were my patient, the question I would ask that, does your hearing serve you well enough that you're able to easily engage in the conversations and activities that are important to you? And the other part of it is that when we start disengaging from conversation and activities, it doesn't just affect you with the hearing loss, but the people that you're actually with. If they're not able to continue to engage in activities and conversations the way they would like to, things bring quality of life to them, then that hearing loss does impact them as well. So when you ask about how to have conversations with patients who need hearing aids, I ask them to think of also about the stress and fatigue and anxiety and workload placed on the individual whom they spend the most time with. And by you being able to listen easier, does that impact their ability to function and their ability of quality of life? So those are important questions to ask.
Oh, okay, thank you.
Kathy Williams is our.
Okay, go ahead.
Kathy Williams' hand is up.
I was just going to, and you touched on some of this. If you have tinnitus, which I do, do you need to be having regular hearing tests because of that? And I have been tested for when I first noticed it, but it was years ago. I don't think it's impacted my hearing, but I don't know for sure because I haven't been tested to see. But I mean, is tinnitus a sign that you are going to have the hearing loss?
So tinnitus is simply a symptom. That's all that it is. We don't have a condition called tinnitus. We have a symptom called tinnitus. Symptoms like pain, itching, swelling, burning, tingling, symptoms are how the body tells the brain that that particular body part has lost some health. And for us to make sure that we pay attention to that and make sure it's not something we should worry about. That's our brain keeping us safe. So tinnitus is a symptom that only the ear has. And so when someone has tinnitus, it's telling us that there's been some shift in the health of that ear. And oftentimes it becomes evident when we do a hearing test. A hearing test is more than just a test of how well you hear, but it's a reflection of the health of your ear. So tinnitus is actually expected. If you have a hearing loss and you don't have tinnitus, that would be far more less expected than when you have tinnitus. So tinnitus isn't telling us anything. It's not predictive. It doesn't tell us anything whether your hearing is going to get worse, but it just tells us at that moment in time, your ear has lost some health, and this symptom is the result of that.
To honor our time with Mike, Jenny Cook will be the last comment question.
Thank you. You mentioned people coming to you even if they have gotten over-the-counter aids, but I'm wondering what would be the reason someone would come to you and say, this isn't right? I'm asking because I know when I get my new glasses that they're wrong. And I'm in the middle of that right now. I had two efforts to correct it, and now I'm seeing somebody who's very, very special because I know the glasses are wrong. How does one know that you're not getting the correct or maximum effect from the hearing aids and come to you?
Well, I think to me, it just simply does it meet the demands that they have? Have they tried a hearing aid and then started to engage in the activities that drove them to get a hearing aid? And how are they performing? Are they finding that it's better? Or are they finding that, if it's a noisy room, I'm still not doing as well as I should? I'm hearing more noise than I am speech. If they feel like they're just not functioning at a level they need to function at, that's the first part of it. Now, there could be reasons for that. One could simply be that the device itself is not programmed appropriately. So the self-programming of the device based on a hearing test you do with it in your ear may not really be the most appropriate setting. So again, how they function with it is for me, the question mark is, I tried this. Yeah, it's just the needs that I have, it's just not helping me like it should. Other reasons could be it's not fitting well, it's not secure, it's not comfortable. I don't know how to use certain features that may help me. So you're kind of on your own with some of that. I shouldn't say completely on your own. Some of the consumer sites do have support, some of these, and they can certainly help through some of that. But that's the long-winded answer, I think, to your question, is that it just simply has to do with how am I hearing with it? Am I actually, does it making a difference in how I'm functioning?
Thank you.
Very, very informative. And I think that your slides were very clear. They really do help go through the issue very much. So we really appreciate what you have done. Thank you so much.
Yeah.
Thank you, guys.
It really
Thanks
is
for having me.
wonderful.
It was a great pleasure.
Good. Thank you.